for most kind of patients we're seeing, they're going to be presenting with some type of pathology. What's the appropriate mechanical stimulus that you can apply to obviously not irritate or aggravate their symptoms, or potentially, further aggravate their pathology? At the same time too, what's the appropriate mechanical stimulus where you're going to get some positive adaptation too? Because there's also the issue that you can have of applying a lack of stimulus and therefore getting nil effect. But the other thing to consider then as well is what is their response over time? And this is where we need to think with regards to adaptation, something we've talked about when we think of hormesis, of that primary versus secondary response. Because yes, we need to be considerate and cognizant of that primary response not severely exacerbating their symptoms. We may see some adverse effects associated with applying a mechanical stimulus, and we can think about what those are from regard to things like DOMS or muscle soreness. For this individual having very little or basically no physical training history, it's very likely she's going to experience some of that. But then more importantly, is she going to get the secondary response that I hope for her to achieve? And part of that can be associated with her symptoms. But also, how long is it going to take her to get that response as well? Because given the fact that she has a lot of poor health markers, her system's ability to adapt
is going to be blunted.
Is quite low, and that's quite.
Or you'd expect it would be blunted at least.
Yeah, and this is something that it's very important to think then too of what's actually regulating this, because when we apply mechanical stimulus, when we talked about this concept of mechanotransduction, you're creating mechanical signals that get transferred into chemical and electrical signals that upregulate certain
molecular pathways,
and therefore, like at the nucleus level, DNA to create, say, new tissue. But the other thing to understand though too is that response is tightly regulated by the immune system. And I think that's something that we need to really highlight, that if you think even just from muscle hypertrophy level, when you think about satellite cell activation, proliferation, differentiation, the myoblasts and so on, that is all regulated by the immune system, by certain cytokines and macrophages providing the signals to the tissue to go, this is what you need to do in this particular order and process. And that's very influenced by that individual's hormetic profile. So if we need to really think in a much more holistic sense of what's this person's health status and how does that influence the type of interventions I apply with regards to intensity, frequency and so on.
Yeah, because I think this heavily fits into obviously why we see different responses from individuals based on whatever intervention we put in place.
Yes.
And it builds on obviously what we were talking about in the previous discussion around, as we mentioned, the diagnosis and what we see in terms of the symptoms.
Absolutely.
And now this is kind of the next step of what we see from the intervention. And we mentioned that obviously, people will respond differently to the same pathology to their tissue. And one of the things that I think is really important about this idea of building these safe to fail experiments is taking that information and then being willing, and there is a little bit of professional courage, I would say, that you need to develop to be like, okay, I'm going to trial this. I believe it's safe. And then, with the consent of obviously of the patient, go through that process, explaining to them along the way, we're going to trial this. We want to see what the response is. You may see or experience an increase in pain, or, these are the symptoms we need to monitor for. And the part that I think is the most relevant is bringing that patient along for that journey and them understanding that process. That it's not that you're guessing and just, as I said, throwing trials of anything that has potential.
Absolutely.
What you're doing is trying to guide their system to a place of the best healing as possible by exposing it to stresses that you think are going to be beneficial.
Absolutely. And
that can be tricky because sometimes they don't necessarily want to feel like a guinea pig in that process.
Well, yeah, it makes me think of that straight away in terms of the psychology